Hi, I'm Dr. Mark Jackson.
And I'm Dr. Julie Park of Carolina Vein Care and Aesthetics.
And we're going to talk a little bit about spider veins. First of all, what are spider veins? Well, spider veins are just little stringy, almost like spider web looking tiny veins, primarily on the legs, that we see quite often in our practice.
So what are some of the causes of spider veins? Well, many people just have the spider veins and they don't have the large ropey varicose veins, which can often go hand in hand. But mostly the reasons why people have spider veins is from genetics. So if you had a family member such as your mother or father who had them, you have a high likelihood of developing them also.
And the symptoms actually are quite mild, particularly compared to the larger varicose veins. Most people who come in to have their spider veins evaluated and treated are there primarily because of the appearance of the veins.
So what are some of the treatment options for spider veins? Well, we offer what's called sclerotherapy, and we use a very effective agent called polydocanol. And all it entails is using a very small needle that gets access into the spider vein, and then the polydocanol is injected into the vein. And what it does is it causes a lot of inflammation and causes the small spider veins to collapse and eventually scar down, and with time they will disappear and fade.
Yeah, and the results are excellent and the medicine is very effective. But one thing that I think it's very important to establish are expectations of the patients. A lot of times the patients will come in, they'll have any number of spider veins and expect with one session they're going to all be gone. If only that was the case. As it turns out, the medicine is very safe, it's very gentle on the skin, and probably as a consequence of that, when it is injected into the veins and it doesn't harm the skin, not 100% of the veins will go away with any given treatment session. It's quite more often the situation that they might need repeated sessions to get as many veins to resolve as they want. And that often just depends on what the patient's expectations are and what their desires are for outcome. But with enough treatments, whether it's 1, 2, 3, or more, we can achieve the results you need.
So a question that we get many times is, are spider veins harmful to our health? The answer is no. They are just unattractive and people just don't like the way they look. They're very conscientious about the way they look on their legs. They're afraid to wear shorts or bathing suits or short skirts. And so they do not cause any symptoms typically. Some people may say they may itch a little bit or burn, but for the most part, they are not harmful to your overall health or to your vein health. On the flip side, varicose veins are much larger. They're at least 3 millimeters in diameter, and everybody knows what they look like. You've seen them on many individuals where they are those large, tortuous, snake-like veins. They're purple and big, and they can cause a lot of symptoms. People are very symptomatic where they complain of heaviness and aching and throbbing and swelling, which is obviously very different from spider veins, which do not cause any type of symptoms.
A question we commonly get is what causes the spider veins? And the reasons are really pretty simple. It boils down to genetics. Essentially, if mom and dad had them, you're more likely to get them. And in terms of any activities or positions or crossing the legs or standing on concrete floors, really those things have little, if any, effect. Basically, if you're going to get the spider veins, you're going to get them.